the size of the tracheal tube has been determined, it should be removed from the sterile packaging. The tube and cuff should be examined for visual signs of accidental damage and ensure the lumen is free from blockage. The integrity of the cuff and inflation system should always be checked prior to insertion. Once the length of the tube required has been determined, cut the tube to the length desired. Do not cut close to the joint between the inflation line and the main body of the tracheal tube, as blockage or leakage of the inflation system may occur. Firmly insert the 15mm connector provided into the tracheal tube. Do not use lubricants to assist the insertion of the connector into the tracheal tube, as disconnection may occur. Then apply a small amount of sterile water-based lubricant to the distal end of the tracheal tube. Ensuring that the patient's head is in the sniffing position, the laryngoscope should be gently introduced through the open mouth. Check that the lower lip is not caught between the teeth and the blade. The laryngoscope blade should be aimed towards the right-hand corner of the mouth. It may be necessary to use a right-handed laryngoscope, whether a bad or capped teeth. The blade is placed against the tongue and advanced along its curve. Staying in the midline is very important. A visual reference to the uvula periodically will confirm the midline position. The blade is advanced along the tongue towards the epiglottis, which will be seen in the anterior structures of the neck as the patient is lying down. The tip of the blade is advanced to the base of the epiglottis. Now lifting the whole laryngoscope in the direction away from the front teeth, but such that the epiglottis can be lifted up towards the ceiling, the epiglottis lifts up and almost curls up against the laryngoscope blade tip. Then right behind the epiglottis, the vocal cords can be seen as two straight, thin, white bands around the entrance of a hole, which is the opening of the trachea. When the vocal cords or part of them are visualized, the endotracheal tube of choice is passed through them.